DHMOSH Public Health Leadership Series. And this is a series where we're really just trying to share some of the important leadership skills and training that we can share with all of you who are leaders in the public health area. You may not be a physician, you may not be a nurse or healthcare practitioner, but you may work in the area of public health. And so, you're welcome here to listen to what we have to share with you. So today we're really happy to have Jason Lang with us. Jason is from the CDC, and he is instrumental to this scorecard that we're going to talk about. This is the CDC Worksite Health Scorecard, and it's a tool that it's really helpful to organizations in terms of how they can organize, initiate, implement health promotion programs and practices. And I've been looking at this tool for a while and trying to think about how to use it for our purposes in the UN. This tool is really targeted for US organizations in the United States, but I think is very valuable as well. It's very evidence-based. There's a lot of things we can learn from this tool. So when I was looking at it, I thought that, why not just kind of have CDC themselves present to us what this tool is all about, and then we can start our own journey to see if we can adapt it or use portions of it for ourselves. So we're all going to learn about this together. So before Jason start, I just want to introduce him. So Jason Lang leads this program, the CDC Workplace Health Program, where he manages projects and provide leadership for the CDC National Center for Chronic Disease Prevention and Health Promotion since 2007. It stands for NCCDPHP. That's such a long acronym, my goodness. So his responsibilities include acting as a coordinator between all the different divisions of the NCCDPHP and liaises among CDC centers around workplace health. He provides subject matter expertise to government and private sector partners. He works on models of chronic disease program integration in the workplace. He works directly with the private sector to develop employer-based tools and resources for workplace health assessment, program development, and evaluation. Jason has authored more than 25 peer-reviewed articles and book chapters on workplace health promotion, healthy aging, and chronic disease prevention. He's a graduate of the 1998 Public Health Prevention Service, a CDC postgraduate fellowship which consists of work at the CDC headquarters in the field. And prior to this current position, he was a project officer with the CDC Healthy Aging Program from 2001 to 2006. He received his MPH and MS from the University of Michigan in Ann Arbor and lives in Atlanta, Georgia. So we're really happy to have Jason with us. I'm sure we have a lot of questions for him in this area. So he's going to give us a presentation for about half an hour, and then we can go on to question and answer. If you have any specific questions that you're thinking about, just feel free to put in the chat stream, and then we'll address it at the last 15 to 20 minutes. So over to you, Jason. Thank you so much for joining us today. And you're muted, I think.
I'm not going to get very far being on mute.
Yes.
Thank you,
we
Dr.
can hear you
Tan.
well. Thank you. Yeah.
Thank you very much. Good afternoon, good morning, everyone. It's a pleasure to be with you all today. What I'd like to talk to you about today is kind of the backbone of our CDC Workplace Health Program, and that is the CDC Worksite Health Scorecard. It's an instrument that we initially developed back in 2008. It's undergone several revisions and iterations since that point. And as Dr. Tan alluded to, it really represents an inventory of all the evidence-based and best practices that organizations, in this case, employers, can utilize in their worksite settings to improve the health and well-being of their employees and staff members. So what I would like to address with you all today is, hold on a second. Oh, okay. I'd like to briefly start with just some general benefits of workplace health programs, kind of why we have a program at CDC to begin with. Then I'd like to move into how we develop the scorecard and why we develop the scorecard. I will then talk briefly about kind of the type of users that we have for the scorecard and what we're seeing in terms of their level of workplace health program and practice. And then maybe not as relevant for this audience, but I just wanted to share very briefly kind of the main way that we use the scorecard for data collection purposes, how employers who are our primary audience report and complete that information. And that may also be food for thought for all of you and how you might want to implement a similar type of assessment. So I'll start here with some high-level benefits of these programs. We have a chronic disease epidemic in the United States. It really accounts for the vast majority of all of the annual healthcare expenditures that we have. So there's a definite need in the country to mitigate or prevent chronic diseases and their risk factors. And this field of workplace health promotion has been around for over 3 decades, and many studies have shown over time that these programs, when they're done well, when they're implemented with fidelity to the research, when they're set up for success and sustainability, can have a number of positive benefits for both the organization as well as the individual employees that work in the organization. Some of those can include, obviously, improved health, well-being, and safety, decreased disability, healthcare utilization and cost, reduced absenteeism and presenteeism. And if you're not familiar with presenteeism as a concept, that is really when an individual is not sick enough to stay home from work. So they do show up, they are present, but they're really very unproductive because they are dealing with, either mental health issues or physical health issues that really occupy their time and distract them from whatever their job responsibilities are. Increased productivity, creativity, and engagement. For a long time, employers have used workplace health programs to attract and retain top talent. That obviously contributes to the overall productivity and creativity of the organization, but it also reduces the retraining or rehiring costs involved with a lot of turnover if you're in an employment setting that has high turnover. And then, many companies that we work with are publicly traded on the stock market, and not having to offset all the costs related to healthcare, pharmacy, disability, compensatory care, and the like can help boost our stock market performance. We did a national survey a few years ago before the COVID pandemic to look at the level of overall workplace health programming in the United States, and further breaking that down into kind of topical areas that employers are focused on. What we found is a little less than half of all employers, and this is from a 1 or 2 person entrepreneurial startup company all the way up to and including the largest Fortune 50 type of employers that are, actually global and international. But across the board, found little less than half have any type of health promotion program. And then, you can see on the slide here, many programs predominantly deal with kind of the chronic disease lifestyle risk factors that are driving that 90% of all the healthcare expenditures. So things like physical activity, diet and nutrition, stress management, tobacco cessation, obesity, and the like. Further, we asked respondents to this survey, more generally speaking, what type of intervention strategy were they using in their programs? And the Healthy People National Health Objectives for the United States outlines 5 different critical comprehensive elements for U.S. worksite health promotion programs. They're shown on the slide here, things like health screening, integration of health promotion into your organizational structure, health education, linking various programs together, and creating a supportive social and physical environment. So if you have all of these 5 things present in your worksite health program, it is much more likely to be highly impactful and successful over time in achieving whatever health objectives or productivity objectives that you have. So you can see that for U.S. employers, again, we don't hit more than 50%, a majority, on any one of these individual elements. And when we looked at employers that have all 5 of these elements, which is really the key to success again, we only found about 12% that have those. So there's a good news and bad news situation in that we are seeing these programs on the rise across the country, and that is certainly trending in the right direction. But we still see very few employers who are putting in all of the key elements together to really set them up for long-term success. So what is the CDC scorecard and how can it be used? The CDC scorecard principally is an organizational level assessment. It really is designed to look at an employer or a work site's capacity for health promotion and disease prevention at the work site. It can be used after this initial assessment, or you create a baseline for planning purposes to design a workplace health program. And then upon reassessment, it can be used kind of to evaluate the changes in organizational capacity that an employer observes over time. It's largely focused on chronic diseases and their risk factors. This is in part because the part of CDC I come from is the Chronic Disease Center. So that's where our work is focused. But again, it is really being responsive to the leading cost drivers that employers and the nation and its employees are exhibiting, which are largely in the chronic disease space. We do have other health topics that I'll cover in a second associated with the scorecard, but really it began as a chronic disease prevention tool. So I touched on this a little bit, but why did we first develop this? Again, we have this chronic disease epidemic in the United States, so there's clearly a need to do something about this. There are solutions available. There are a number of best practices, including counseling, environmental supports, health promoting policies, benefit plan design strategies, and other programs that have been shown to be effective in preventing chronic diseases and their lifestyle risk factors. So we do have a solution set available. But as I mentioned, we see, few employers that are actually employing this. So there is a gap between what we know works and what is actually being done. So the scorecard really serve as a bridge to get knowledge about what works into the hands of folks who can put those strategies and interventions in place to be able to make health improvements locally or at a community level. Lastly, when we first started our scorecard project, we saw very few validated worksite health tools, ones that had undergone rigorous testing and evaluation. And so we wanted to make sure that was part of our process when we developed the scorecard. And I'll describe what that process was like in a moment. The scorecard is 154 items. Every question is a yes/no question, so it is an all or nothing proposition. It really asks employers, do you currently have this type of intervention in place? Yes or no. So you don't get any partial credit for we're thinking about it, we're planning it, we plan to do it next year. It's whether you have it today or you do not. It's broken down into 18 different topical areas, which are shown on the slide here. Again, they're largely chronic disease related, although we do have things on occupational health and safety. We do have several modules related to mental health, and some of our newer modules like sleep and fatigue, while contributing to chronic diseases, aren't exclusive to that area. The intervention questions that are asked on the scorecard fall into 4 main categories. They're either a organizational level policy strategy, a programmatic strategy, something to change the social or built environment, or something related to health benefits. And health benefits largely includes things like health insurance. As you're probably familiar, in the United States, much of our healthcare is delivered privately through employer-based programs. So certainly benefits would include whatever insurance you have, but it can also include things like your pay and your vacation and leave time and other things of that nature. Last thing I'll mention is all of the interventions that are asked about in the scorecard, everything represents an actionable a tactic or strategy that an employer can take. So it's very action oriented. It's not theoretical or conceptual. It is all very highly geared toward employers doing something about whatever health risks or needs that they have. Those 4 domains of interventions, the programs, policies, environmental supports, and benefits, also align to kind of a socio-ecological framework that looks at all the levels of the organization, from the individual frontline employee to their teams and groups at the interpersonal level. This could also include the relationship with their managers and direct supervisors. We look at the environment as a whole. That will take into account things like access and opportunities for health promotion and disease prevention participation. And we look at the organizational level. So within the organization, I think you can look at leadership support, work culture, and work climate. But this would also extend to outside the organization into the broader community. We at CDC work a lot with very small employers or mid-size employers with a couple hundred employees. Many times these employers do not have the resources to have on-site cafeterias or on-site gym facilities or a lot of infrastructure within their own organizations to do things in-house. They have to really partner with and seek resources out in the broader community to take advantage of the same types of health promotion opportunities that you see large employers being able to offer their employees. We also, in the National Center for Chronic Disease Prevention and Health Promotion, have a priority on breaking down barriers to health equity. And we do that largely through addressing a number of social determinants of health. And those are shown on the slide here. The CDC scorecard aligns quite nicely with several of these areas. There are a number of questions that you can see here related to the built environment, such as walking trails, showers and changing facilities, or doing stairwell enhancements if you work in a multi-story building. Food and nutrition, there are ample opportunities to offer food and beverage at the worksite through various points of service and sale. The scorecard asks about questions there. Several questions around community clinical linkages. Examples here could be the use of telemedicine, access to chronic disease self-management programs, how you design your benefit plan around prescription drug coverage, social connectedness. I mentioned that as one of the healthy people key elements around built environment. So we have several strategies that engage employees and management in the process, whether that's through setting up active and diverse health promotion committees to inform and drive the health promotion effort at the worksite, issuing different types of surveys to get input and engagement from employees, and obviously tailoring your health communication and health promotion efforts to ensure that everyone is heard and everyone is spoken to. And lastly, tobacco-free policy environments. There's an entire module on the scorecard dedicated to creating tobacco-free environments at the worksite level. So I mentioned briefly about our process. This slide really kind of shows you how we put the scorecard together. We started with a very extensive literature review. We looked at published peer-reviewed literature between 2005 and 2016. That resulted in over 1,100 studies of various interventions done at the worksite across those different topical areas that I showed earlier. At the end of the day, our final scorecard included references and citations for over 500 of those studies. We did put a series of stakeholder interview panels together to kind of solicit and elicit information from employers, from brokers, from healthcare providers, and others engaged in this field to see what was really of importance and issue with the worksite setting right now in terms of health promotion, disease prevention. So that informed kind of how we organized the different modules and what we were interested in covering in the scorecard. We then put together a draft list of questions for each of the modules and then had them peer reviewed by various subject matter panels to really do two things. First, to kind of tell us, are these the best questions to ask relative to the important priorities for that particular health topic based on the evidence? And if the answer was yes, to include the question in our final version of the scorecard, if they would help us rate the question in terms of its scoring. And I'll talk more in a moment about how each of the items in the scorecard is scored. From that, we had a few rounds of review and edit and revision, and eventually ended up with an instrument that we wanted to pilot test. Our pilot test involved 93 separate employers. They came from all kinds of industry sectors. They came from all parts of the country. They represented different sizes employers with different needs and opportunities and barriers. And so we got feedback from them, as well as additional feedback from leaders in the field and employers themselves. And in terms of the pilot study, what we had was 2 respondents from each employer independently complete the scorecard so that they could conduct inter-rater reliability and make sure that the questions being asked were clear, concise, specific, and accurate in how they were being asked and answered, so that at the end of the day, the employer and we at CDC would get the best information back. So ended up with another revised instrument, which eventually became our final version of the CDC scorecard. And I think I mentioned we're currently on our 3rd version. The 2019 version is our 3rd version of the scorecard. The first version was published in 2012, and our 2nd revision was published in 2014. So in terms of the scoring, as I mentioned before, every question on the scorecard represents a specific action, strategy, or intervention that employers can put in place. Everything in the scorecard is evidence-based and effective. However, some things give you a bigger bang for your buck, if you will. They are more impactful. They drive the needle a little deeper and farther than other things. Several of the strategies are differentiates themselves in terms of their complexity and how they're implemented, or how much they cost, or the time involved to either staff them or plan them out and implement them. So we take those things into account to give each item on the scorecard a score between 0 and 3. Now, you receive a 0 score if you indicate no when answering the question. So, as I mentioned, the questions are asked, do you have this strategy in place, yes or no? If you answer no, you'll receive no points. But if you answer yes, you'll get a score of either 1, 2, or 3. You can kind of think of these as like Olympic medals, the gold, silver, and bronze. So it's a significant achievement no matter whether you finish first or third. If you medal in the Olympics, that is something to be celebrated, and everything is good with that. However, you know, you want to win. You want to be the gold medalist rather than the bronze medalist. So the score reflects two main components. There is an effectiveness component. So while everything is effective, some things are more impactful than others. And then there is a health impact score. And that also is, you know, things may change your behavior a little bit or result in some health improvements, but other strategies will give you much more bigger health improvements and health impacts. So as an example, we have several questions about sharing health information with employees. You can do that through bulletin board materials, online dashboards, brochures, print materials, or what have you. Those are good things to do to raise awareness, to maybe get people thinking about behavior change. They don't necessarily result in a lot of behavior change or the health improvements that follow changing of those behaviors. Those would be 1-point strategies. But if you can get someone into an intensive lifestyle counseling or self-management program, that is very impactful. So that for diabetes management or tobacco cessation or any number of other conditions, that could be a 3-point strategy. So all of this methodology is detailed in what we affectionately call the Blue Book. This is the manual that describes how we came up with the scoring for every question, the methodology behind that, and all of those 500 plus citations and references that detail the evidence-based used for each and every one of the questions in the scorecard. I alluded to this earlier. We work a lot directly with employers so they can do this for themselves and start setting up their own programs. As the nation's national public health agency, we work a lot with our state and local health department counterparts. I work with a lot of nonprofit organizations, professional organizations, healthcare brokers, healthcare providers who work with employers. All of them can benefit from understanding the organizational capacity strengths and gaps that you identify by taking the scorecard assessment. And if you reassess annually, year after year, to track and monitor those changes and progress that you're making over time. So we work with a lot of folks who we provide technical assistance, resources, tools, training, other things to help them understand this health promotion framework, to understand how the scorecard's organized, how it can be leveraged for maximum impact within worksite settings. So real quickly here, I just want to cover kind of a profile of who's using our scorecard currently. We have had basically employers from across the entire country utilize the scorecard. The ones that are shown in darker blue on this slide, these are states where we have had very concerted direct efforts to reach out to employers and offer them additional training or technical assistance, or in some cases provide seed grant funding to help them get started with their program. Because of that additional effort that we're putting into those states, we've seen larger numbers of scorecards submitted and utilized during the time period shown on the slide here, which is no surprise. There's just more of a concentrated effort there. But even without that, we've seen employers from coast to coast take advantage of the CDC scorecard. This is a busy slide. I'm happy to share these slides with anyone who wants them, so don't get caught up in all the detail here. But we've had thousands of employers utilize the scorecard over time. We've reached millions of employees across the country through those employer efforts. And in the bottom right-hand corner, or the right-hand column, is a reassessment rate statistic that we have. And this is really kind of looking at who submits a scorecard, and is this your first time doing it, or is this a second, third, fourth, fifth, multiple time that you've done it. And we're about 45 to 55% reassessments, which indicates to us that we're not only attracting new employers to use this tool on an annual basis, but we're getting a lot of employers who are continuing to use it over time. And that shows a good success from our standpoint, in that we're still growing our audience, but we're also getting the kind of long-term organizational improvements that we want to see by having employers use this and the strategies within on an ongoing basis. We pull employers from all different types of employer segments, governmental employers, for-profit businesses, as well as nonprofit organizations. It's a pretty even split here from our data. We also have seen a pretty decent split in terms of the size, from very small employers all the way up to the largest employers. As I mentioned, we're a little skewed toward the small and very small employers, with about 50% of our total usage among that group. And that's just because that's where our marketing, outreach, and technical assistance efforts really result and focus. Those small employers tend to need more assistance, have fewer resources, have less history with these types of programs, whereas the largest employers in the country really have the capability and wherewithal to kind of take this effort on by themselves and don't need a whole lot of additional assistance. This just represents all the different industry segments that we have seen from ScoreCard users. Every single industry segment is represented. We do see more usage among the healthcare and social assistance segment, educational services, other services, and public administration, which is really governmental organizations. I think this is due in large measure to the fact that there's a natural alignment many times between the type of things the scorecard covers, its orientation, how it frames things, and the business mission of those types of organizations. So you can understand, if you're a hospital and you work in healthcare, you understand disease prevention and health promotion. It's not a stretch for you to understand the core principles and strategies that are being talked about in the scorecard. It's a very natural alignment. That alignment may not be as strong if you work in the information technology space, for example, or a public utility company that offers, electricity or water. Again, very busy slide. Do not focus on this. I just want to make a few key points here. Typically, what we see is the larger organization that you are, the more and higher uptake of all strategies we see in the scorecard. And that's represented well on this slide. The other thing is this represents data from 2021 and 2022. So kind of 2021 being the height of the COVID pandemic, when many employers were temporarily sheltered in place or shut down, and many workplace health programs in our country were suspended, versus 2022, when those employers, businesses, schools, other organizations began to reopen, re-invite employees back into the worksite, open their doors to their patrons. You see a big uptick in the percentage of programs that are being reported as yes now as compared to 2021. So everything in green represents an increase over the prior year. So we're seeing a nice rebound in these programs that kind of were temporarily suspended during the pandemic. Similar thing here. These are just for nutrition and physical activity questions on the scorecard. Again, we trend up as we get larger. We see a lot of increases in terms of what is being offered last year compared to 2021. We do see some red in this slide, and that's because those strategies actually decreased from the prior year. I think this is largely due to, while many employers are reopening, getting back to the physical work sites with their employees, many employers have introduced a hybrid work model now where folks work from home or off-site. And so offering things like an on-site fitness facility or an on-site cafeteria really aren't needed anymore because the number of employees that are there at the worksite on a daily basis is not as high as it was pre-pandemic. And that is why maybe you're seeing some of the red downticks for those kind of built environment, physical environment strategies. Lastly, let me just wrap up here with our online web application. This is how employers kind of take the scorecard assessment and can track their progress over time. This is done by creating an online account. This is the landing page to get you started with that. It is a free tool. There's no charge to use it. It does kind of provide the employer an account profile, a number of different dashboards that lets them see kind of the number of work sites that they have, the in-process tracking of where they are in their scorecard completion. It obviously gives them access to the scorecard instrument itself. And we have a number of reports that are available immediately after completion to help employers interpret their results and help them get started on their program planning and implementation efforts. This is just what the instrument looks like in the online environment. We have radio buttons for everyone to complete the yes/no questions. It allows you to jump back and forth between different of the topics. So you don't have to complete this linearly from question 1 all the way up to the last question. You can jump around, complete different items, complete different modules. You also are able to save and come back at a later time. So because the instrument's rather long, this online feature allows people to kind of take it at their own pace and not have to do it in one sitting. It also allows us to, or the employer, I should say, have as many people involved in scorecard completion as they want. So when you look at wellness committees or leadership teams or occupational health and safety teams that are responsible for these programs, all those various perspectives can be granted access to the scorecard account, and they can all go in at the same time and complete various questions or modules at the same time. So that reduces the burden on any one individual to be responsible for the scorecard completion. We do have a number of reports that look at kind of your overall score or topical score, or at the detailed level kind of looks and compares how you're doing to other employers by individual items. So individual interventions, individual questions. We have a report that looks at what you have in place versus what is still available for you to put into place. We call that our intervention in place report. We have the ability for large employers who have multiple work sites to create sub-accounts for all of their individual work sites and a report that compares how one work site is doing to other work sites in the same organization. And then we have a heat map program progress report, which shows on the next slide here kind of how an individual employer is doing relative to the percent of total possible points available for a scorecard. So if any of the items show up as red or orange, that indicates to the employer in a very quick visual way that they are just beginning to develop their program. They have a lot of strategies that they can be doing, and they can really focus on prioritizing those and working to build that capacity. Once you get to the yellow and the green, you're starting to receive the lion's share of the points available, and by extension, you have most or many of the interventions in place that the scorecard describes. And even if you have few interventions in place, the ones you do have in place are likely to be those 2 and 3 point questions, because you're getting a high number of the total possible points available. So those show an employer that they have reached a level of competency or an advanced status of their program. And so they are moving from kind of building their effort to more of a maintenance phase. If you're interested, we put out regular updates about our scorecard and other program efforts or tools and resources that we have developed to help employers with developing and sustaining their programs. You are free to sign up for our newsletter or join our program website, which is cdc.gov/WHP for Workplace Health Promotion. And with that, thank you again for your time, and I'm happy now to turn it back to Dr. Tan and have a discussion. Thank you.
Great, thank you so much, Jason. It looks like a really good tool and product. I have just a question in terms of what are your thoughts in terms of adapting this tool for our purposes? I mean, you know, we're in obviously more resource low countries, and maybe not all of them would apply to us. Is there a way that we can adapt it such that, for example, you know, we leave out some of the items, or, I mean, is that a possibility, or do we just have to kind of reconfigure it just for ourselves independently?
Yeah, I would recommend, you know, the web application that I described briefly there. The way it's set up is the only way you can submit and get access to the reports and those kind of things is if you answer every single question. So I probably would not recommend that approach for your group. We do have a kind of paper pencil version of the scorecard, shows all the questions and everything, but would allow you to kind of pick and choose the ones that make most sense to you. I would say the questions that we have related to employer-sponsored health insurance and benefits, because of the way the U.S. healthcare system is structured, probably would be the least relevant set of questions that we have, and I probably would pass on those kind of things. But many of the built environment, organizational policy, health education, most of those questions, in fact, are very relevant and germane to any employer setting in any country, I would think, in the world. So I would take a look at those. The other thing I have available, and I'm happy to share with you, it's part of our online system, but I can pull out the manual and send it to you guys for offline use, is we have looked at every question in the scorecard, and we have categorized them on eight dimensions. Some of those dimensions are cost, the time involved to bring the intervention from conceptualization to implementation, the level of skill or technical ability to put that in place. Some things you can do very little training on and be ready to implement. Other things require physicians or pharmacists or people with lots of training to be able to implement. So it kind of looks at strategies across that dimension. That will give you a great indication based on your individual capacity, resource level, experience, or need or interest, what you could focus on. So I think that would be a great resource for you all. And if I just had to guess, I think there's well over 100 items or questions in the scorecard that would be perfectly adaptable to your circumstances easily.
Okay, sounds great. Thank you so much. We just have a question about employer participation strategies. I guess, Stephen, you probably mean employee, right? Like staff participation strategies and approaches that worked well. Yeah, are you able to tell us a little bit about how to encourage kind of staff to participate more on such activities?
Yeah, so we've looked, there's been a lot of studies done, some I've done or been a part of at CDC, other leaders in the field have looked at really kind of what are the barriers for participation for employees. The number one barrier that consistently comes up time and time again is time. So it is being able to either take time off to go to the doctor or participate in a physical activity class or, do whatever it is, or find time during the day to do that. So time is a consistent barrier. Strategies to combat that are, what can you integrate into the normal workday where you're doing health promotion, but you don't even feel like you're doing it. So a very simple thing is you put stretch breaks into your morning team meeting before you kick off the day. Here's what we're going to do today. Here's the marching orders for today. What are the issues we need to be around? Well, as part of that, we're doing some stretching. So we're still working, but we're also getting some physical activity in. That's walking meetings. There's flex time policies where, you're giving people, your employees, your staff, time during the day that's blessed by management to go participate in a webinar or a lunch and learn educational opportunity, or go down to the gym if you have one close by, or walk the campus or something like that. Also strategies around bringing clinical preventive services on site. So rather than me having to leave my job, drive a half an hour to my doctor's office to get a immunization, can I bring the immunization to my job site? Can I bring the screening to my job site, where all I have to do is walk down the hall to get it done? That doesn't take any time. So there are a lot of strategies around time. Cost is another one. So the more things the employer can offer, either free or subsidized for the employee, that helps. And the last one is to make it fun. I mean, that so many employers and for that matter, employees as adults, we forget that we like to have fun too. We're not children. We don't have fun like children do, but we still like to have fun. And many employers set their programs up where it feels like a chore. It feels like something I'm compelled or forced to do. And that takes all the joy out of doing it. So the more employers can be creative about making these opportunities fun, more employees will engage. And part of the fun factor, I will say also, is changing them up over time. So don't get stagnant. Once you put something in place, you've got to revisit it every year or every 6 months or every couple years so that it doesn't get stale. Because people don't want to participate in the same thing over and over and over and over again. They would like to have something fresh and new.
Mm-hmm. Great, thank you so much. Yeah, talking about free, we recently launched a program where we worked with a company called LifeSum, where we gave free weight management nutrition apps to staff, and we launched it on Monday at 9 o'clock, 9 something, and by 11, like all 1,000 licenses were gone. We had like within 2 hours or 90 minutes, 1,000 people like grabbed the free app. So that was really good. Yeah. But
that's fantastic.
But some questions that came up. So Josette, any recommended strategy to change staff behavior at the workplace that impact negatively their health? Josette, do you want to describe more about your question? To elaborate more? I think you might be muted, Josette.
Yeah, she
Oh,
cannot.
okay, all right.
Yeah.
Okay, so I'm not sure if I understand it correctly, but strategy to change staff behavior at the workplace. I guess you mentioned that
Yeah,
already, covered some of that already, yeah.
yeah, I mean, kind of again, like that socio-ecological framework, you can look to change behavior at the individual level. So that's education, skill building, self-management programs, tobacco cessation classes, things of that nature can be very effective. Where we at CDC spend a lot of our time is in that interpersonal and environmental levels. So, we're trying to reach every employee in the organization. So not every employee is going to be overweight or obese. Not every employee is going to have hypertension. Not every employee is going to be a tobacco user. So what can you do to change the physical built environment or the social environment that really makes health promotion kind of embedded into your day-to-day experience, your lived experience with work? So if you're looking at lighting, noise, ventilation, tobacco-free environments, designing the layout of your job site to promote physical activity, whether that's through stair use versus elevators, having a nice outdoor space to walk around with paved areas, nice landscaping, something visual to look at outside, or even inside the building, putting printers or copy machines or meeting rooms a walking distance from where folks have their desks and do their day-to-day work, so that they're forced to get up and move around through the day. There are a lot of things you can do environmentally and from a policy lens that create a more healthy environment that whether you want to or not as an employee, you're exposed to it. And that's where you can get all of your employees to start adopting healthier behaviors. And if you couple that and marry it with those individual intensive things for folks who have a chronic disease or a very high risk for developing a chronic disease, or have a negative health behavior that you want to change, then that really starts to amplify and catalyze, the change that you want to see happen. So
Right,
I
yeah,
would
I guess
recommend doing both.
yeah, the combination of the individual at the, peer pressure, but then also at the policy level, right? All these
Yes.
different tiers have to be
Yes.
addressed together, yeah. One question from Dr. Ling about when we look at the scorecard, is there anything like an effectiveness rating? Because I know that you choose the intervention that is evidence-based. That's what I really like about this. Like, when I look at that list, I know that CDC has done the groundwork to make sure that these interventions are the ones that supposedly work in a workplace setting. But is there a way to say that, okay, this one works a little bit more than the rest, or are they kind of all equal in that sense?
No, that I'm sorry, I apologize if it wasn't clear when I was talking about the scoring. So if the score, whether it's a 1, 2, or 3, is based on 2 components. One of those components is the overall effectiveness of the intervention. And that basically means this intervention says that if you do it, this is the outcome that you expect to have, the change that you expect to see. And we further break that down on a 4-point scale of, yeah, it does what it says it does a little bit, or it does what it says moderately, or yes, every time without fail, this will be very effective. So yes, we do have an effectiveness rating. We do break it down. It is part of that overall score. And I would say that the slide with that blue book on it and that link, I would encourage you to go look that up for any one of the questions you're interested in, and find out how effective, based on our literature review and our subject matter experts who reviewed it, think that each individual question is. But you're right that overall, everything is somewhat effective or at least a little effective. Everything is at least a little bit effective, but some things are much more effective than others.
And you referred to the book and all that. Is that in these two links that you put here?
Yes.
Yep. Okay, got it. Okay, great. Do we have any other questions? But if not, I think this is a really good start for us. I think it helps us understand health promotion as something that is really should be evidence-based. It's not really just like, I want to do this, I want to do that, right? And so I just think that the scorecard has been around for a while, and it's really great too. I've been looking at it for quite a while. And just thank you to your team for all the work as well that you've put into this. And yeah, we'll love to continue to work with you guys and talk to you guys about how we can potentially adapt it for ourselves. Or maybe if it's not that far off, we could potentially just use your tool, run it a few pilots with our clinics, and then kind of see how it goes as well. Maybe we can do that as well. But I can discuss a few offline on that. Yeah. But
Sure.
yeah, thank you so much. Yep. And go ahead.
I was just going to say, we have seen some international adoption.
Okay.
Brazil has translated and used the scorecard in Portuguese. We've translated and used the scorecard in Spanish. Korea has used a modified version of the scorecard. So there are international examples of using our scorecard as a basis, but then adapting it to local needs. So happy to continue that conversation with y'all.
All right. And in terms of language, what languages is available?
The ones, English, obviously, Spanish, Portuguese, and Korean are the ones I'm aware of.
Okay, because we need probably in French. Usually English and French. Spanish is good, but at least English, we need it in French probably. But yeah, maybe we can work on. Is there any chance that you guys may translate to French or no?
Possibly, if there's a strong enough need for it. That's really what drove kind of some of the other translations. And in the example of Korea and Brazil, they took it upon themselves to translate it.
Yes.
And obviously it's, you can do a literal translation, and then you can do the cultural context translation, which is what we did for Spanish. It's not a literal translation in Spanish because some of the idioms and the concepts don't translate well in Spanish. So I'd really want to have folks not do a literal translation of this, but really get what the meaning behind it is. And if that means you've got to do a cultural translation, please by all means do that, because at the end of the day, you want the audience, the recipient, the employer who's using it to really embrace the concepts. We use the scorecard not just as an assessment tool and an evaluation tool, we use it as a teaching tool, because it really has all that evidence-based framework and the interventions in it that are shown to be effective. And we want to educate employers about those things and how to go about doing them.
Great. Thank you so much. Thank you so much, Jason. I really appreciate it. Thank you to all of you who participate. And, when you have time, take a look at the scorecard. This is just a brief introduction, a small bite-sized introduction, but I think it's really great because it's evidence-based. We have something to hang on to, and potentially we have an easy tool to use as well. So let us think about it a little bit more and develop this idea a little bit more. But thank you so much, Jason. I appreciate your time. And thank you for everyone. I hope you have a good day ahead. Thank you.
Thank you all very much. Have a great day.
All right. Bye, everyone. Thank you.
Bye-bye.